Hi everyone, my name is Dr. Michael Wald. Thanks for joining me, and if this is your first time joining me, welcome. So I'm nicknamed the Blood Detective. I've been in holistic clinical practice for about 33 years, and today we're going to talk about dementia. So I'm going to give you a brief overview of what dementia is, some medical approaches to dementia, and very importantly, questions that may indicate whether you have dementia or some other cognitive issue. Because lots of people will say to me that they think they have dementia, but it really isn't that. So here we go. Now, to begin with, this information is for your education. It's not meant as a substitute for sound medical or health advice. So here's a few things that you should know about dementia. And we're going to talk about that along with who gets it, how common it is. Are there differences between memory loss, confusion, and dementia? That's key. The differences, I'll repeat it, between memory loss, confusion, and dementia. And then what are the medical and holistic treatments for dementia? So I'll give you a brief description right now of dementia. So dementia is a general term for a decline in cognitive function severe enough to interfere with daily life. And you can imagine there's a whole spectrum of dementia where someone just doesn't remember certain things. Other times they lose the last 20 years of their life, all varying expressions of dementia, if you will. So dementia is not considered a specific disease, but a syndrome, you might say, that includes memory loss, impaired reasoning, and behavioral changes. Common types of dementia are Alzheimer's disease, which is considered the most common, and vascular dementia, Lewy body dementia, and frontotemporal dementia. And there are other types. Do you know which type you have, or maybe it's a loved one or a friend? Many neurologists don't review this, and they also, so what happens is a person has dementia, a family member usually brings them into their primary. The primary says, yeah, it's probably dementia, and then they write them a script for a couple medications. The medications for dementia don't tend to work well. They should be referring that person to whatever other doctors, let's say like a cardiologist, to look for vascular issues, because someone could be having microclots, for example, and that's their dementia, and that's a vascular issue, not just a neurological issue. Then on the other hand, someone might have the more common type of Alzheimer's disease, where there's an accumulation of proteins in a specific area of the brain, and that is a completely different type of dementia and way of treating it. And the same thing for Lewy body dementia. So this is a very brief conversation on dementia, but just know that there are many different causes for dementia. And the areas of the brain that are commonly affected with dementia and memory loss are overall memory, language, decision making, emotions, and behavior. So sometimes a person will present to me that their family has brought them in and said that he went from a kind person to angry all the time. And that could be a sign of dementia. So differences, or I should say variations away from the person's normal way of being and acting might be early signs of dementia, no matter what those are. Listen to this. It's incredible. Over 55 million people worldwide live with dementia. That's according to the World Health Organization. 1 in 9 Americans aged 65 and older have dementia. They have Alzheimer's dementia, and that's right from the Alzheimer's Association. This is an epidemic. This is out of control. Now, what's the age-related risk to dementia? Risk doubles of dementia approximately every 5 years after age 65. Every 5 years, it doubles the risk. And most doctors just watch this and report it, but none are deep diving into what to do. And the first thing to do is try to get it early. Risk factors. The most significant risk factor is age. The older you are, the higher your risk for developing dementia. Then a family history and genetics, that's also another major factor. And a test known as ApoE4 is a common biomarker that is checked, which can signify and does signify an increased risk of dementia, substantially so. Cardiovascular disease, that's a risk factor. Lack of blood to the brain, various areas of the brain die off. Maybe it's personality, maybe it's memory, maybe it's cognition, maybe it's all of those. Head trauma, any damage to the brain, that should be common sense. And then smoking is related to dementia. Inactivity, poor diet, and low mental stimulation. How many neurologists do you know that review activity levels beyond just saying go exercise? Really looking at the diet specific for this individual who has these symptoms, which may be dementia. And there's mental stimulation, which is becoming less and less thought to actually be a major player. You know, they used to say use it or lose it. And I'm not saying don't stimulate your brain, but it's not all you should be doing. And I mentioned distinguishing the difference between memory loss, confusion, and dementia. So as you can see here, we've got symptom, and then down along the left column there is memory loss, confusion, and dementia. And then there's a dementia connection all the way to the right. So for memory loss, we have trouble recalling recent or past events. That can and often is an early sign of dementia. Some doctors blow that off by saying, oh, that's just memory loss. It's normal with aging. Yeah, I don't think so. Then confusion, disorientation to time, place, or people, a strong sign of brain decay, regardless of what the cause might be, which often worsens as dementia progresses. And then dementia itself is a syndrome with persistent memory loss, confusion, and decline in a person's thinking skills, which include memory loss and other cognitive areas of decline. So what are some medical and holistic approaches for dementia? So the medical approaches, I've listed the medications here for you. And again, as I mentioned, they are not very useful. They may be more or less useful for certain subgroups of people depending on the cause or causes of the dementia. Now, regular people seem to understand this. When I say regular people, I mean people that have no medical background. They seem to know that diet and activity and all these things are fundamental for health. And they also know that it's important to find out a cause of something rather than just throw medications at it. So perhaps that some of these medications, they might work better in some forms of dementia, and we'll leave it at that. And then there's behavioral therapy, which might help modify the agitation that some people experience with the dementia or any kind of cognitive decline, depression and anxiety, and various cognitive trainings and rehab. So that's the medical approach. And then I've given you some of my thoughts here, but I will warn you that, when I work with a person with cognitive decline or dementia, I'm looking at their individual chemistries. I'm going over careful medical health intake to find out where I need to focus. Maybe this person has a dementia, I might believe, due to heavy metal contamination. Another one, I think it might be due to hormonal declines like testosterone and DHEA, which can lead to brain atrophy. I might think the person has dementia because of viruses, bacteria, fungi, parasites, for example. The list goes on and on. But these are some general kind of guidelines to think about. A Mediterranean diet, which is rich in fruits and vegetables and lean meats and healthy fats like monounsaturated fats from avocados and omega-9 fats from olive oil. You just want to make sure that the olive oil or any olive oil that you use, you have it in a tin. You do not want to be able to see the olive oil through the container. If you can see it, photons of light see it, and it's going to break it down and turn it into a rancid product, which may not smell rancid. Then when you eat that fat-soluble rancid mess will be intaked into your fatty areas of your body, which includes your brain. So a Mediterranean diet might be a good idea. Some people need that plus a much higher protein diet. Maybe they're gluten intolerant, maybe they have diabetes. Whatever all of the health issues are, I put together a plan, a food plan for that person. Then, of course, exercise, the right form of exercise. We know it boosts blood flow to the brain and helps what's known as neuroplasticity, which is the term I've talked about in other podcasts, which refers to the ability of the brain and nervous system to repair itself. And that's largely based on nutrition. Sleep hygiene. If we don't have proper sleep, you're just not healing anything. And then various nutritional supplements, for example, omega-3 fatty acids, vitamin D, B-complex, curcumin, resveratrol, but there may be many others depending on the individual's needs. And then mind engagement, puzzles, music, socializing is a big one. Okay, so let's get to this screening questionnaire, because responses to these questions will indicate in a large, I should say, to a very, very accurate level of measure whether or not someone has dementia. So there's a dementia screening questionnaire, which is designed to help identify if someone may be experiencing the early signs or late signs of cognitive decline. So this is not a specific diagnostic tool. So in other words, in addition to this, there's another tool we use. Those of us that are interested in this topic in healthcare, there's a mini mental exam and other types of questionnaires. And the more of these that are used, the better. So some of the questions are the following. So do you frequently forget names of people you've recently met? And if that is a chronic problem with you, you may have a problem in your brain, particularly in the areas. I've actually given you the areas here called the hippocampus, specifically in the medial temporal lobe of the hippocampus. So knowing the location of the brain injury might help with nutrition and even certain medications. Do you find it difficult to remember appointments or planned events? If so, that may be an issue with your hippocampal region, but a different area of the hippocampus, known as the prefrontal cortex. They're not important for you, obviously, to know these other areas, but I thought I'd give them to you because some of you requested me a lot of detail. And if you start to talk to your neurologists about this, so you mentioned prefrontal cortex this and medial temporal lobe that, they might actually take you a lot more seriously because most people don't speak in a medical language, and that's why a lot of the consultations, they're not very fruitful between you and your physicians. Do you have trouble following conversations or getting lost mid-sentence? That's in Wernicke's area in the temporal lobe. And do you repeat questions or stories during the same conversation? That may be a problem with the hippocampal prefrontal cortex. Do you misplace things and are unable to retrace your steps? Replacing things is normal, but if you can't trace your steps, there's something wrong. Just a few more questions to give you an idea of how useful these questions are. Do you have any difficulty making decisions or solving simple problems? Have you shown changes in personality, mood, or behavior? And that's something, if you're watching this, if you're concerned about yourself, you'll need to ask people around you that know you well about these things. Do people mention you're acting differently than before? Are you withdrawing from work or social activities? Do you find language tasks more difficult than previously? Do you have trouble understanding written or spoken words? Now, I've already read 10 or 12 questions or so that are 10 or 12 questions more than most of your practitioners will do because they just go right to the pad, right to the prescription pad. Once I evaluate someone in this area and they want to address what they feel is dementia with diet, nutrition, and healthy lifestyle, that's what I will do. I will do various laboratory tests specific to the person's issues. I will eventually give them a food plan, not just the Mediterranean diet or the best diet for dementia, but a food plan that might have elements of many different diets that are doable for the person, that are specific for what their needs are. And then when I compare them to laboratory-wise to the regular ranges of normal, I also compare them to healthy people because it usually opens up all this other nutritional potential. And then when I give nutritional supplement advice, the supplement doses need to be based on the testing, need to be based on the conditions, and the doses need to generally be formidable, much higher than recommended daily allowances. So recommended daily allowances are the minimum amount of a nutrient to prevent a deficiency disease. An optimal amount of a nutrient is the optimal best dose that the person needs. So that's what we always want to do. If we get dementia early or cognitive decline or confusion early, we have the best chance of reversing that or mitigating that process. So thank you so much for listening today. I hope that it was useful for you, and I'll see you at the next podcast. Thank you.